I think what's special about our practice is the fact that every single patient is recognized and treated as a unique entity. We're all different. In medicine, has to be individual, has to be tailored to that person, to expectations and also to their medical reality. Technology itself, it adds resolution, it helps us understand better, it helps us measure. And there's also subjective information, like what's happening in the joints, the muscles are sore. Those things are harder to quantify, they're harder to measure. Technology, of course, helps by speeding up the process. For instance, like the scanner that we're using. That scanner, whenever I scan, like what I did yesterday for Kunal, I just saw it, he sees it himself. And all of a sudden, he's a lot smarter because he saw his mouth from a totally different perspective than he saw it before. Okay, if I have another 2 or 3 scans in a year from now, that's why I tell everybody, you come, we'll check. I can see the status at this point in time. Then we're gonna add to all this wealth of information one critical factor that we don't have yet: time. And as you go through prophylaxis or checkups, the time factor adds more data. And these things that otherwise I would probably catch them, I would see them myself, but probably when they're too involved or when the patient notices themselves. There's certain things that I cannot measure with my eye. So technology basically helps us detect things earlier and helps us establish trends. The key is not to have data, the key is how to correlate that data and extract valuable information out of it. Once we have that, in about 2-3 years, I'm going to know what do you need in order to stay healthy. So it's much better to treat or to manage a trend or to manage a risk rather than to manage a problem.